Hello everyone, welcome to Medial's at Last channel. So today we are going to be talking about femoral hernia. So before we learn about femoral hernia, let's talk a little bit about the femoral sheath. Um what is a femoral sheath? Femoral sheath is a funnel shaped. It is a funnel shaped facial sheath, and it encloses the upper 3 to 4 centimeters of the femoral vessels, and it basically diminishes inferiorly by joining the tunica adventitia of the femoral vessels. And here you can see the femoral artery and the femoral vein and the femoral nerve or femoral branch of genitofemoral nerve. So this is that. And here we have the lymph node of Cloquet. Lymph node of Cloquet. This is the lymph node of Cloquet. And we'll learn a little bit more about what this is. So, this femoral sheath is divided into three compartments. Okay, so this is the lateral compartment. This lateral compartment has the femoral artery and the nerve part, whereas the intermediate part has the femoral vein, and the medial part has the lymph node of Cloquet and space, the dead space. And this dead space is quite important because it helps in accommodating, for example, there is increased venous return. So when there is increased venous return, this vein will expand more, and when it expands, to accommodate this expansion, this dead space kind of plays a significant role in that. So this is the dead space, and it is also known as the femoral canal. This part this part is the femoral canal, and the upper part of this is known as the femoral ring, which opens into the abdominal cavity, right? So this is the femoral ring, and it opens into the abdominal cavity. Now let us talk about this femoral ring. This femoral ring, it is basically um covered or closed by fatty areolar tissue, which is known as femoral septum. This is fatty areolar tissue, and this is known as the femoral septum. That is about the femoral ring. Now, let us see the boundaries of the femoral ring. So, this is anterior side, and this is posterior side, and this is medial, and this is lateral, as you can see here. So, anteriorly, it is bounded by the inguinal ligament, medially, it is bounded by the lacunar ligament, and posteriorly by the pecten pubis, P for P, and laterally by the femoral vein. So, you can see in this diagram the femoral ring is over here, anteriorly by the inguinal ligament, medially by the lacunar ligament, and posteriorly by the pecten pubis, and then femoral vein on the lateral side. Now then we have the femoral hernia. So let us talk about the femoral hernia. So femoral hernia is nothing but the protrusion of abdominal contents through the femoral canal is the femoral hernia. So here we have this femoral hernia. How does it present itself? It presents itself as a globular swelling inferior and lateral to the pubic tubercle. It is inferior and it is lateral to the pubic tubercle, and it is present below the inguinal ligament. Now then here we have how it actually happens. What can be the causes? So here we have pregnancy, repeated forceful coughing, or straining. Any of these three can cause increase in the intra-abdominal pressure. When this happens, the distension of abdominal contents takes place through the femoral ring, and due to this, the femoral ring expands. It enlarges, as you can see here. It enlarges. Now, then we have this little part that you need to know. If this is the femoral ring, as the abdominal contents, the it can be a loop of intestine or anything. The abdominal contents, as they distend through this femoral ring, they also bring along the peritoneal covering. So the loop of intestine along with the peritoneal covering that descends through the femoral ring forms the hernial sac. So this is the hernial sac. And then let us talk about the course of the femoral hernia or the femoral sac. How it how its path is. So the abdominal contents or the femoral hernia or the femoral sac, this part we're talking about this, right? So first of all, it enters the ring, and then it enters the femoral ring. It passes through the femoral ring, and then it enters the femoral canal. Obviously, it passes downwards through the femoral canal. Then it moves forwards and enters through the saphenous opening, right? And then it pierces through the cribriform fascia, bulges forwards, and then moves upwards into the superficial fascia of the thigh, along with the superficial epigastric vessels. So, this is the course of the femoral hernia or the femoral sac. Now, let us talk about the coverings of the femoral hernia from superficial to deep. It is covered by skin, superficial fascia, cribriform fascia, femoral sheath, and femoral septum. Right. Now, let us talk about the strangulations of femoral hernia. So, what is meant by strangulation of femoral hernia is nothing but not strangulation, that's the wrong word. Strangulation means basically getting stuck. So, not strangulation, strangulation of femoral hernia. So, what about it? Femoral hernia, when the femoral hernia gets stuck, it leads to severe abdominal pain and nausea and vomiting. So this happens because the femoral hernia gets stuck, and surgeons will basically remove this or release this strangulation by cutting off this lacunar ligament, as you can see here, as the femoral ring. To remove this strangulation in the of the femoral hernia getting stuck in the femoral ring, they remove this lacunar ligament and they release the strangulation. Hope you enjoyed the video. Thank you everyone, and please do like, share and subscribe. And if you have any doubts, comment down below or DM us directly through the Instagram. And also do follow us on Instagram and also on Telegram. Thank you.